Welcome to this clinical supervisor emotional competence skill building program. At the moment we are focusing on the learning environment. In exercise 5, we particularly identified toxic learning environments, and we're now going to look at how do we actively counter such environments that we may be working in. So there's a few things we can do, and on a very basic level, as much as we can talk about the fact that emotions causes all the mess, of course, physical factors do have a huge impact. And any physical factors that causes massive amounts of stress or exhaustion is going to put extra strain on your department. So they've shown, for example, a clinician that's awake for more than 21 hours roughly has the same performance as a person with a blood level alcohol of 0.08, so somebody who is actually over the limit. And therefore looking at what's happening with our on-call setups, looking whether people are getting tea breaks or lunch breaks, making sure that they are a safe space where they can go and have a few minutes to breathe, and giving people permission to actually also breathe in their day is a very important part of creating a more healthy environment. But probably the most important part, and in some ways also the most difficult part, is the thing that affects the whole department underneath it is actually what happens at the top. And so one can call it role modeling, but it's almost like a cascade effect that if you have a leader and supervisor, so your people who have power within the department, coming to that department from that warm, curious, calm space we've been talking about, that creates trust within the workplace and actually creates a cascade of this is how we roll in this department. I think all of us know how difficult it is if you've got a leader at the top or a supervisor at the top that is very stressed and very aggressive and very toxic, how that affects everybody around them. And so this is one of, when we're talking about environment, where actually the responsibility very much sits on the leaders and the seniors within that department. And what one can imagine is you need to think in terms of yourself as a person showing up to work. Say you're a clinical supervisor, and you want to start looking at how do we create trust within the workplace by creating positive emotional spaces. So we've talked a little bit about those distressing emotions that causes all of this counterproductive behaviors, but actually we can also actively build positive emotional spaces into our workplaces. The first positive emotional space, very important, is how do we bring care into our workplaces? And that simply means being kind and considerate of people there, being aware of who's in the department and what's going on in people's lives, and approaching each other with that warmth and respect that we all need within our relationships. The second emotion that is also a positive emotion that makes things more fun is play. So that's the social part of things, and making sure we have actually spaces for people also to socially interact with each other, and also creating opportunities after work for social interaction, and bringing some fun into the work. And then I've spoken about this amazing emotion of seek. So seek is a natural positive emotion that we have whenever we are busy trying to solve a problem, or we're trying to learn something new, we're figuring something out. And it's that exciting part of exploring, learning, developing. And that is an active emotion we can try and cultivate within our departments. And when we talk specifically, when we're going to be teaching you feedback skills, a lot of what we do in feedback and what we do within our role play is all about how do we create that seek space, that it's actually quite exciting learning rather than working through humiliation or making people feel that they're somehow defective and that's why they have to learn. Can't we just, how do we create a space of excitingly exploring things together? Your most powerful tool when you are dealing with other people's difficult dragons, so it's all very well you arrive nice and calmly at work, and then you have people at work that is in stress mode, is compassion. So remembering your stress, your survival level is very much somebody who's not feeling safe for whatever reason. And when we bring compassion to that people from our own sort of higher level, that makes it possible to make somebody feel a little bit safer and potentially calm them down. It's not a guarantee. So you can't always calm people down if they're extremely freaked out simply by being kind. But I can guarantee you that every single other thing you are tempted to do in that moment will only make things worse. And your any potential, the possibility there is to restore safety and to restore them back to themselves is through bringing compassion to those people in your department. The third thing is actually actively looking at, like, from a leader point of view, how do I grow a supportive team? And this is working with these higher values, and to not just have them as a poster on the wall that nobody ever reads, but if you've picked specific values, we have all these values out of Ubuntu and Bato Pele. So for example, if you have clear values in your training department of inclusivity or respect or generosity, that those are continuously bringing into your teaching program, and that you actively encourage that within the department, and also counter any behaviors that is not aligned with these values that you have assigned yourselves to. It's also, and we'll have a separate session where we'll talk about specific methods okay, this is the way that we do things, and that becomes the standard sort of modus operandi for everybody in the department, and everybody is kept to those standards. And that in itself just creates good habits. So when we feedback, instead of going straight into criticism, we are better at listening, and we are better at picking out also what works well before we simply come in with our criticism. So for this last exercise, we're actually going to go and reflect back on exercise number 5, where we identified whether our environment is somewhere on the scale from 1 to 5. Doesn't matter if you are on a level of 1 to 5, yay. But if you are anywhere up from level 1 to 4, you want to think, well, how do I move this up a level? I've identified the factors. That means I'm still sitting only at this level. And if you are at level 5, you want to think about, well, why are we at level 5 and how are we actually going to keep it there? And so now I want you to think in terms of those, the 3 things we've just looked at. So are there things that we can change to our physical workspaces, our systems, in terms of making things less stressful? Is there things that you as a clinical supervisor can bring, personal changes you can make into the environment to bring more care or play or seek emotions into that environment? And is there a specific initiative, for example, using values or training people on feedback methodologies, etc., that might help your department move from more toxic to a more supportive environment? So you can discuss this in pairs, or you can reflect upon it in your own time. Thank you.